Thanks, Renata, for taking the time out to speak to me today. I really want to introduce you to people that may potentially be interested in joining us in Melbourne for Inspiration by Integration. So please, can I get you to explain a little bit about yourself and how your background from a dental hygienist to what you do today?
Of course. I was a dental hygienist for about 10 years and always wanted to do more, always help the office with everything more than just hygiene, because I was always trying to find ways to grow and to serve people more, because I feel like I'm one of the clinicians who was called to serve. Um, and I went to a continuing education class and they started talking about myofunctional therapy. And I was immediately drawn to it. I said, this is it. Because as a dental hygienist working in an office, there's only so much that you can do. And then you hit the ceiling. So I was about there. And when I learned about Mayo, I was just completely blown away that there was so much more I could do for my patients besides just cleaning, which is, cleaning and oral hygiene is great. But this was something bigger, something that touched my heart because, of course, I'm an Airway patient. My kids are Airway kids. So that's when I never looked back.
Yeah, and now you really have your own practice with multiple clinicians offering myofunctional therapy virtually, correct?
We do. It's called MyoMoves, and we see patients in over 20 countries. Alyssa and Jennifer are the girls that work with me, and Kim Balkema, and they do a wonderful job. And our patients, I mean, the results speak for themselves. We are very blessed to have the patients that we do trust in our care, because it's one of those things that you always go, but how are you going to do this online? What do you mean? You don't have to see me, as clinicians, we want to be there. We want to touch, we want to take the photos, we want to, but we are super picky with the way that they take their photos, the way that they do their videos. Whenever we are doing the video conference, also, we got to make sure that there's good lighting, all of those things, because we cannot put together a good treatment plan if we don't have a really good evaluation. So our evaluation is actually 2 appointments. It's not just one. 2 whole appointments, at least 2 hours long. And we go, very, very thorough through the whole history. And then the assessment to make sure that we are giving that patient the best care that they can have.
Fantastic. And Renata, a lot of people have been asking me, is this course suitable for beginners? And I want to say, yes, it is. I have asked you when you come to do your presentations geared to beginner level so that we can provide a really good overview of these topics. However, I think that if you are an experienced practitioner in myofunctional therapy, it's still a really important event to come. We want to gather together and really advance this field. And it's a really great opportunity to hear from different speakers with different backgrounds. And it's the conversations, the discussions, and the networking that will be really valuable to people who are experienced. For those who are not experienced, can you talk a little bit about what myofunctional therapy is?
Of course, myofunctional therapy is a treatment modality that focuses on the muscles of the face responsible for chewing, breathing, swallowing, speaking, even though we don't do speech, and tongue position. Your tongue position is actually a function of your body, and a very important function. So myofunctional therapy, they're not just exercises to optimize the function of these muscles. We're looking at everything. I always say that not dental hygienists, but myofunctional therapists are the middle puzzle piece of the whole Airway team, because we're looking at their tonsils. We're looking to make sure they can breathe through their nose. And based on our findings, we're looking at the structure of the face. Based on our findings, we're sending these patients to an orthodontist or a dentist or an ENT, even physical therapist, occupational therapist. So we have to know a little bit of what's going on all around to make sure we know when to refer and what's going on with their patient. So if you're passionate about healthcare and learning how to better take care of these patients, myofunctional therapy is one of those professions that you never stop studying or never stop looking, because things are always changing. As far as for beginners, 100%, I feel like whenever I teach, I'm able to break things down where it's easy for people to understand, where it makes a lot of sense. And then also, a lot of my training comes from Brazil. And we have, 5 or 6 girls who are the volunteers in Airway Circle, and everybody has taken a different course. So we teach a course together, and just from working together with them, everybody has taken different courses. So we are always learning from each other. So even if you're a seasoned myofunctional therapist, I believe that everybody holds a piece of the puzzle in this field since we don't have standardized education. Every time you go to listen to a different speaker, you're going to get some nuggets that you didn't hear specifically that way before. We're all learning things a little bit different. So, and the way that they're doing in Brazil is just fantastic. They're, at least from the United States, they're 20 years ahead.
Oh, yeah, for sure. I think you have the advantage of being able to speak Portuguese, and that's really brilliant that you can bring along this knowledge. And so, specifically for people who are attending, can you discuss the role of myofunctional therapy in children's airway problems?
Oh my goodness. The incredible thing is that now it's a perfect time for us to be talking about this because there's so much new research coming out talking about how important it is for the muscles of the face, which include the oropharynx. And the muscles of the oropharynx, if they are really weak, they're more likely to collapse. If somebody has a tongue tie, it's more likely to fall behind and obstruct the airway. And we are responsible for those muscles. So all of these studies are coming out saying how lack of mobility or lack of tone in these muscles does affect sleep. So as a myofunctional therapist, you guys are looking at all of that. You're looking at the tongue mobility. There was a study recently that just came out talking about the tongue mobility specifically for obstructive sleep apnea for kids. There's tons of my friends, sleep physicians, who will do just a tongue tie release, nothing else. They do a DICE procedure, tongue tie release on a child, and the DICE again, and apnea completely goes away. Do we claim that it cures apnea? 100% no, we never claim that, but there is a correlation. And the more we talk with each other, the more we collaborate, the more we do studies, the more we're going to be able to find out exactly what are the best treatment approaches for each individual patient. So this meeting is going to be incredible with some of those speakers. Oh my goodness, I can't wait to attend.
Yeah, and we're very lucky to have Sarush Jaggi on board, who will give the best possible presentation on tongue ties in relation to airway issues. And can you specifically mention about the role of myofunctional therapy in conjunction with tongue tie release?
Sure. So in order for the frenum underneath the tongue to be released and the tongue free to move, there's so much that goes into the movement and the function of the tongue that we need to make sure everything is optimal before we even go there. So usually we see the patients first to optimize the area, make sure they can breathe. A lot of people don't know this, but one of the highest risks for a tongue tie to reattach is if they cannot breathe through their nose. Because how can they keep their tongue up there if they can't breathe? They're going to have to keep their tongue low as it's healing. So we always check for airway patency, and we, of course, refer if we have to. So we're working on breathing. We're working on just dynamic movements and then increasing tone on that tongue. They need to have enough awareness. Where is the tongue supposed to stay all day and all night? So whenever it's released, it automatically goes up there because it's already used to being up there. It's already used to being reminded to be up there. Because just releasing the tongue is not going to automatically fix the function of the tongue. If the tongue didn't know how to move before, it's not going to all of a sudden learn to move properly. Our bodies are so intelligent, and if the tongue is restricted, the movement is restricted, we're engaging incorrect muscles to do the function of the tongue by itself. So we do have to teach the patient, close your eyes and think about how are you swallowing? Where's your tongue going? So we do a lot of awareness exercises, including with the conditioning of the muscles of the tongue, and then we work on function. So the release itself, it's part of the whole treatment. You know, it's not just that procedure. It's a whole process. I think Jennifer Talazon that says that it's a process, not a procedure.
Absolutely. Yeah, so the other thing that I thought would be really interesting if you could share, a lot of people will want to know about adult palate expansion. It's not as widely available as it is over in the US. I've got so many colleagues having it done at the moment, but can you share your experience regarding that?
100%, I still have it in.
Mm-hmm.
Can you guys see it? So I got the Marfie on May 11th of 2023, and I started turning slowly. My doctor is Dr. Ilya Lipkin in New Jersey. So I fly to see him, and you guys know that I travel a lot, so I kind of slow down even a little bit more than I was supposed to. I ended up, you guys saw me with spaces everywhere. It was great. And then I started Invisalign as soon as I stopped doing the turns. So of course, he told me to turn until it got to a point that my lower teeth were able to upright enough. Otherwise, I was going to end up with SFOT on the bottom, which is that procedure where they open up, they pack bone, and like that, you can move the teeth out a little bit more.
Mhm.
I didn't want to do that. I told him I want to be as conservative as possible. And by the way, I had no pain,
Mhm.
no pain whatsoever. We do have some patients and some people that report pain, but thankfully I had no issues from the moment I got it. I think 3 days later, I had a little bit of a headache. I did not have the piezo. I have 6 TADs. And I remember one of the things that freaked me out as I was sitting there for him to apply it, I looked over on the computer and it showed that one of them was 17 millimeters long. And I was like, oh my God.
Mhm.
So that freaked me out a little bit. But the procedure, he's fantastic. The procedure was great. And that was from May, and I was probably done turning around September. But I didn't go back to him until probably November to start Invisalign. And then all the spaces closed. Now I have to go back up. I'm going next week to find out what are the next steps. So I'm still with the buttons of Invisalign. But yes, but I can breathe better. I mean, very, very soon after everything started opening up, I could breathe better. I can sleep better. My sleep is deeper. But this week I'm doing a couple extra sleep studies. Aww. You came to give me a kiss. I'm doing a couple extra sleep studies to see how much my sleep has changed. I did not have sleep apnea. My AHI was 1. I believe I had something like UARS. But my father has sleep apnea. He has Alzheimer's disease. And I wanted to prevent as much as I could. But of course, also the nasal resistance. It was, I had a lot of resistance when I was breathing. So I wanted to do something. I knew my palate was super narrow. It was a 31 molar to molar. So this is something I really wanted to do for myself, to be able to breathe better, to be able to live longer, sleep well. And I am so glad I did.
Yeah, definitely. I think if there was the option to do it with a very well-qualified provider here in Australia, I would certainly consider it. I think especially premenopausal women, we definitely have that worsening of our sleep, and it would be a great option to do that. But one of the things, even from a more preventive point of view, is to recognize that myofunctional disorders are the root cause of these problems. And are you willing to share a little bit about your history of myofunctional disorders?
Oh my Lord, I was the face of myofunctional disorder. I always had bags under my eyes, mouth breathing. My siblings used to make so much fun of me. They would take photos of me sleeping because I always thought mouth wide open, snored, always awful posture, forward head posture, shoulders rolled forward, scoliosis, kyphosis, lordosis, I have it all. Tons of back issues. I just had no idea that everything was related. I was really cute when I started growing up, and then all of a sudden, same thing as that picture of the boy with the gerbil. That he was like super cute growing up, and he got a gerbil for his birthday. I think you is the one that shares that. His face completely changed, and the same thing happened to me, and I had really bad allergic rhinitis. And I'm very allergic to indoor stuff, indoor dust. And I'm not sure I don't remember exactly when it happened. I also, when I was 10 years old, I was running and I hit my nose in a pole
Mhm.
whenever I was playing outside with the kids. That could have also triggered something. I believe I broke my nose, and you know how it is in Brazil. They're like, "How many fingers do you see?" Two, you're fine. Blood coming out everywhere.
Mm.
Oh, you're fine. You don't have to go anywhere. So, anyways, I think that a lot of those things probably pushed me to become a mouth breather and develop the way that I did. Very narrow palate, high vaulted, tongue always low. I always burped a lot. I
Mm.
swallow air all the time because the roof of my mouth is so high, and I cannot, lift my tongue up to have the food and the liquid. Only there. There's always air. So that was something that bothered me a lot growing up. But it was more like a focus, not doing great in school. Even though I studied hard, I was a B and C student. It was hard for me. It
Mhm.
wasn't as easy as some of the other students.
Mhm.
So all of that has gotten so much better since I started treating myself.
Amazing. Yeah, no, thanks for sharing. I think that's why it's really critical that as many different child health care professionals be able to recognize those early warning signs. And, really at the
Hmm.
moment, there's about 12 different fields attending or registered. So I'm really excited to bring together these people and we can have these conversations. So yeah, really looking forward to having you in Melbourne, Renata. And thank you so much for your time.
Well, thank you so
Yeah.
much. I'm super excited.